I've had the privilege of, over the years, looking at a variety of approaches to the treatment of colon cancer. And one thing that we've known both in the prevention literature and beyond was that individuals who take aspirin or aspirin-related compounds significantly reduce their risk of developing colon cancer. Now, that's been shown in observational studies. Frankly, it's been shown in randomized trials. So in individuals who undergo a polypectomy, for instance, by colonoscopy, those individuals who are randomized to aspirin as opposed to placebo are much less likely to get subsequent polyps. Moreover, the British doctors' aspirin trial, which randomized British physicians to aspirin or placebo, that study showed that the physicians randomized to aspirin were significantly less likely to develop colorectal cancer. So I think there's really an abundance of data suggesting that aspirin and aspirin-related compounds reduce your risk of developing colon cancer. A related question is, well, what is the benefit of aspirin or aspirin-related compounds in patients who have developed colon cancer? And so we conducted this study, CALGB 80702, which was really to test the hypothesis of aspirin or an aspirin-related compound. Now, specifically, we, in this trial, looked at the drug Celecoxib, which is not aspirin, it's a selective COX-2 inhibitor. Now, why did we choose that drug? Well, because we think that the impact of aspirin, the benefit of aspirin on colon cancer biology is through inhibition of COX-2 or cyclooxygenase 2. So when we designed the study, I think the notion was that COX-2 inhibitors or Celecoxib would potentially be even a more potent agent. As a consequence, what we did is we looked at patients with lymph node positive stage 3 colon cancer who had undergone a curative resection and were now eligible for adjuvant chemotherapy. And those patients all received adjuvant chemotherapy as part of the trial. And in that respect, they received FOLFOX. In fact, were randomized to 3 versus 6 months of FOLFOX, but they were concurrently randomized to Celecoxib every day or placebo every day for 3 years. And the primary endpoint was disease-free survival. And the analysis that's being reported at ASCO this year is the Celecoxib randomization among the 2,500 patients in the trial. And what the study shows is a trend towards an improvement in disease-free survival with about a 10% reduction in disease-free survival, but it is not statistically significant. And so one has to conclude from the study that Celecoxib, at least in all comers and unselected patients with stage 3 colon cancer, that there really is no value, so at least proven value, to that agent. Now, admittedly, I began this discussion talking about aspirin, and the study didn't look at aspirin. There are other studies looking at aspirin, and there may be reason to think that aspirin may be a better drug in this scenario. We'll find out. The other consideration is, are there subsets defined by any things, including tumor biology, where a drug like Celecoxib would be more beneficial? And one thing we're now doing in the study, because we actually have the tumors, we're sequencing the tumors, we're studying their immunohistochemistry of the tumors. So we have a number of studies underway to see if there are a subset in the trial that actually will benefit from COX-2 more than what we found in the study as it's reported among all comers. So that's the results to date, but more to follow from the trial.